Hi, everyone. My name is John Faulkner. I'm your host of the Smarter Systems Better Care podcast. I'm here today with Dr. Kaushal Kulkarni. He is the Chief Medical Officer and co-founder of Predoct. This is an AI-driven health information management platform where they're automating medical record retrieval for clinics and care teams. Welcome to the podcast.
Thanks, John.
And just to give our listeners context to get us started, tell us a bit about your background.
My background's in medicine. I went to med school, residency in ophthalmology, and then I did a fellowship in a field called neuro-ophthalmology, which is complex cases, second, third, and fourth opinions. We can dive into how that led me into the medical record space, but it was really my own pain points that I was facing in my practice that led me here. My patients were coming to me with complex cases, having seen 3 or 4 other doctors and having had labs, MRIs, CTs, pathology. And as you know, in healthcare, the patient often shows up with zero information, expects you to have it all, magically. And I was often sending my staff on a wild goose chase, doing what we call chart chasing, which is basically phoning, faxing, chasing down the records from the basement of a hospital or clinic somewhere. And so that was one problem. And then the other problem was, sometimes they proceed to put 1,000 pages of records on your desk. It's on you to go through those in the middle of a busy clinic when you're already backed up. Patients are screaming in the waiting room. Just to give you one personal, story that illustrates all that. I was in the clinic one day. I saw this young 20-something-year-old woman who got referred to me for a visual problem after being in the ICU of a local hospital for 2 weeks. And she didn't know why she was there, didn't know her diagnosis, didn't know her medications. All she said was, look, I got a paper that told me to come here. I had no records, so I sent my staff on the wild goose chase, sitting by the phone and fax machine for an hour. They get the records from the basement of the hospital, and they put 1,000 pages of records on my desk. But this case was crazy because in that entire stack of papers, there was just one lab value in the entire stack that gave away the whole diagnosis.
Wow.
It was a low thiamine level, which causes a condition called Wernicke's encephalopathy, which affects your eye movements. And every medical student knows that. It's like a board question, like low thiamine causes eye movement problems. But what they don't teach you in medical school is the 2 hours of administrative work that takes to get to that answer.
Yeah.
So that was very eye-opening for me, and what caused me to be here today.
Yeah, that makes a lot of sense for Predoc, how that all started. And what kind of feedback have you been getting throughout this process of development?
Feedback has been great. And I met my co-founders. We were working on the MVP, got it delivered. They went through a New York City tech accelerator, came out, raised a little bit of capital. And within 6 months, we were doing $500,000 of revenue. And got preempted for our seed rounds.
You said you're working with all types of size, like clinics and health centers. Are you working with larger hospitals as well?
Yeah, today we have over 35 customers that rely on our retrieval and analysis products. In many cases, we are the fully outsourced solution that's replacing their internal legacy teams. And we are working across both clinical research and care delivery with a couple of publicly traded companies and very large outpatient roll-ups and IPAs or practices across primary and specialty care, as well as virtual care. And then some of the largest sites and site networks in the country as well for clinical trials.
Okay, so it's all sorts of sizes and areas that you're getting into. And then as far as how do you serve your clients through this process of first engagement through kind of taking them through the process? What's the light bulb moment where yes, this makes sense for us to do this?
I'll walk you through a live customer example that kind of is pretty typical for our average initial contact up to full implementation. We're working with a large publicly traded roll-up of oncology practices and networks. I reached out to their operations officer just organically and pitched them the idea. They were actually trying to hire many positions for medical records administrative roles because they had such a need. They were doing all this work manually of going out and retrieving medical records, sorting through them, and then uploading them into their EHR to onboard a patient for a new oncology visit. This company has 100+ physicians across over 100 clinics in 4 states.
Wow, pretty big.
And they had a centralized operations team. So we pitched them the idea, and he was like, look, I want to try this out. I'm not ready to offboard my entire staff of 60 people that are doing this, but why don't we take maybe 25% of our volume and give it to you, see what the results are? I took the 25% of volume, the turnaround times and accuracy and coverage was much faster. So he was able to basically repurpose 25% of that admin staff, which again are really, really difficult to hire for. And there are much more meaningful roles for those people in the company.
Okay.
We took on like, another 25% of their volume, and he was impressed with the results. He was able to offload 25% of his staff. He started the implementation with our partner API into their EHR, and then now we are the fully outsourced solution. He was able to repurpose all his staff. We're doing all of their retrievals for all of their new patient visits, and they're very happy.
That's excellent. And you probably work with like the bigger vendors, EHR vendors like Epic and Cerner and Meditech and these other ones for integrations.
Yeah, so this is an important point. We're not an EHR, and the reason our product is working and getting a lot of traction is we don't rely on those Epic or Cerner integrations like a lot of the competitors do, because those take a long time. There's a lot of bureaucracy. The way our product works is we are completely neutral to EHRs. The way we've built the technology and the services, we're able to get records from any EHR in the country, whether it's Epic or Cerner or a very small EHR in Arkansas somewhere. Um, and that's because we're able to tap into whatever's available digitally through the exchanges, as well as do the more offline retrievals where it's a manual phoning, faxing, and chart chasing. The only difference is we've infused AI and automation into that process so that we're much more efficient and cost effective.
Excellent. Yeah, that seems like a much faster turnaround and then iterative process as well. That's probably how you're able to shorten, like be able to raise money so quickly and have a proof of concept in place as you're going through.
Yeah, because our thesis is that the incentives in the world of healthcare data and EHRs are extremely misaligned. And we can go, that's a whole other discussion about how that developed with the High Tech Act and meaningful use, et cetera. But it is what it is. Because we are clinician founded and we live and breathe this pain point, we took a very different approach than a lot of the other top down API only solutions that are trying to restructure the whole infrastructure of healthcare. And that's just never going to work.
Yeah. And heard that time and time again, unfortunately. And then as far as you're looking at yourself as a founder, like because I think you just went through a big round of funding, where do you spend the most energy in your day? Like, what does a day look like for you as a founder?
As you know, as a founder, you just do whatever needs to be done. So every day is different, and we all just wear whatever hats are necessary. But my main focus is really on the business development. So because I think that you need very high trust to get to open doors in these hospitals and clinics. And with my background and being actually a user of the platform and a customer of the company, but also someone that is really living and breathing the pain points, my main focus is mostly to attend conferences, reach out to people, and help bring in new customers and develop our overall strategy with regards to different segments and also how a lot of the government regulations, especially with the recent CMS health tech ecosystem announcement, how those are or will affect us. And then with you mentioned the new fundraise, we're hiring. So a lot of my time is spent on the interviewing process and then onboarding some of the new employees that we have.
Yeah, that's exciting. What kind of employees are you looking for, just as a heads up, if people are looking for a position and if it's a right fit?
Yeah, we're hiring across basically engineering and business development and
Okay.
product.
Product. Okay.
We have a super, super talented team of engineers. So the bar is pretty high, but anybody that has a background in healthcare and data science, and especially has worked with EHRs, would be someone we're interested to talk to. We've got some great product people, but again, people with deep knowledge and expertise of this particular space with healthcare data and EHRs. And then again, across business development and sales, people that have experience selling into enterprise healthcare systems.
Excellent. Yeah. I'm sure people will be following up to hear more. And then, like, what's one shift, like looking at this industry as well as a whole, with this documentation burden that people are having or patients coming in, there's literally no backstory. What are things that leaders are not paying enough attention to?
I think everyone's very, very aware of the problem. This is not like an unknown problem. This just everybody knows this problem exists. To answer your question, I would say our unique or contrarian thesis, and so what people are not paying attention to is that There will never be a magic API that connects all of healthcare. There's not going to be a plaid for medical records like there was in fintech. And again, it would take a whole podcast to go into the reasons for that, but it's just not going to happen. And I think what most people are missing, and the reason we're getting traction is because we understood that very early on. And you cannot ask doctors or hospitals or clinics to change their workflow. That is a losing proposition. Doctors and operations leaders at care delivery organizations have many, many other things to worry about and many, many pressures. So you can't ask them to change their current workflow. So what we do is we fit right into their current workflow. They don't have to do anything differently. In fact, we offload a lot of the administrative burden from them. And what that means is we still can work in like the fax, phoning, chart chasing world. They can just outsource that to us. We automate all of that on the back end, and we really deliver an Uber like experience where you get the full complete set of medical records rather than the current solutions that are API only that only get you 20 to 30% of the way there.
Yeah. So it sounds like you're making some good call outs is like, don't try to fight the system. Like, don't break what's not working. Insert yourself within it and show the ROI and the value throughout their process. Like the customer example you gave, 25% offload that to us. Let us show you what we can do.
Yeah. Yeah. And I think what people are missing is that everyone's trying to throw point solutions at the problem, and point solutions in healthcare don't work because they don't actually facilitate the holy grail of headcount reduction or actual reduction to the bottom line. In fact, a lot of the point solutions just add more cost that comes out of the IT budget or administrative burden. And sometimes you need a whole data science team just to make sense of all the data that comes out of these API only point solutions, like the health information exchanges. And that it's the purpose.
Yeah, it does for sure. And like when you look in the day-to-day operations within your own business as you're growing, what are some of the things that still feel kind of clunky or like slower than you'd like to see moving?
There's so much more room to automate these very, very manual, painful medical record exchange processes. And we actually see that as that's actually an advantage to us is that we were willing to take on the clunky work of these manual faxes and phone calls. And we still do a lot of that clunky work. But because we have done hundreds of thousands of these, we completely understand every single edge case to this process. And we have a ton of training data that we can train voice AI because that's becoming better and better. And we can more and more automate those manual processes. But yeah, today when I look at it, there's still a long way to go.
Yeah, we're getting there, but not quite yet. It sounds like for sure. But you're definitely making a lot of headway in your own space.
Yeah, I mean, we completely embrace the clunkiness and the manual part of it on behalf of our customers. And on our end, it's our job to automate more and more of that and get the cost down.
And then how do you handle things like I know it's a little different than like a patient showing up for the day and you do a follow-up visit, right? So how does that kind of that's like the analogy I'm trying to use. How does that work as far as in the documentation space? You're trying to get information on automatic fashion. How do you keep the request keep going, or like is there at a point where it says, hey, I don't know what to do? Is there like a human in the loop in the process to interject?
Yeah, definitely human in the loop. So we try and do as much as we can automatically, both for a new patient or if it's a return patient to refresh their history and medical records. But there's very much a human in the loop because, again, a lot of times the patient doesn't even know where they've had care.
Yeah, they forgot or something, right?
If they know at least like the zip code or the name of the practice or even what type of specialist in what state they've seen, we're building more and more ways to back into finding that provider roadmap and then going out and getting the records.
Yeah, that's another factor. Sounds like you have to think of all the scenarios when that may occur. The patient may not have any idea where they went in the past, or just because of the complexity of their medical issues or something. Maybe they just forgot, right?
Yeah, exactly.
And like, what's working really well at pre-doc that you would never want to lose at this time?
Honestly, it's the team. The team is incredible. And I think our investors saw that early on because at the seed stage, you're really just investing in people,
Yeah,
in the team. Through whatever serendipity, every single person we brought on has been top notch. But the most important thing is there's just a lot of cohesion between the team. Everyone's got strengths that augment each other. And we're all friends, to be honest, which is very, very rare.
that is, yeah.
Extremely rare. So that's, I think, is our greatest strength. And that's the thing that I don't think we will ever lose, but would obviously never want to lose that.
Yeah, that's a great thing to have. Like, how big is your team out of curiosity right now before you get into this next growth stage?
Yeah, we're at about 20 FTEs right now
Okay,
across engineering and product and sales.
excellent. And then if you're looking at like the opposite end of the spectrum, like what's been harder than expected despite all the effort that you've thrown into it?
I don't think when we went into it, we didn't imagine how hard retrieving medical records is. Somebody could look at that from the outside and be like, I can do that. Like, what's the big deal? And I see people doing that in other spaces. For example, there was a recent big thing where Epic decided to roll out their own voice AI for medical scribes when there's companies like Abridge, et cetera, that have raised, a ton of money. And people were commenting that it's over for those companies, like their value is going to go to zero because Epic's doing it now. And I was like, look, it probably sounds very easy from the outside that you can just push a button and have a great voice AI. But I can tell you from the medical record space, things that look easy from the outside are really, really sticky and difficult.
Complicated.
I would not be so quick to think that someone can just push a button and automate a very, very difficult workflow.
Yeah. And it's good to have competition in the space because it only makes it better for patient care and everybody.
Yes, of
So,
course.
yeah. So if you solved all these bottlenecks, all these issues that you run into, what does success look for your company in the next 6 to 12 months?
6 to 12 months is a very short time frame.
Yeah.
I don't think we're going to solve everything in that time. But again, we're laser focused on really this particular area, which we just put under the umbrella of health information management. So one is the retrieval of records, both online and offline. The second would be return of information. That's when hospitals or clinics get requests for medical records. That is also another whole manual process, which we're working on automating AI. And then the third is okay, I have a population of patients in my database, my CRM or AHR. Unfortunately, those were not built to do population level analytics, either for clinical trials or care delivery. But can we now use AI to go into the EHR or CRM, mine the population of patients and then pull out the insights that I need? So those are the areas I would say probably in the next 3 to 5 years.
Yeah.
We
Long
work
term.
and from there we just keep going to adjacent areas. There's like you mentioned, there's no shortage of problems to solve here.
Yeah. And for sure, there's always something you can work on to get better from there. But as we're at the end of the podcast now, where can our audience find you if they want to connect and learn more?
Predoc.ai is our website, and all of our information and contact forum and case studies are on there. And yeah, would love to hear from anybody.
Yeah. Thank you for your time today. It was a great conversation.
Thanks, John. It was great talking to you.
You too.